It makes walking difficult, it makes picking things up difficult. It's making holding my fork now a little bit difficult.
There were times where I had to crawl to the bathroom because my ankles were so painful.
I always left school early and my friends always thought I was faking being sick.
The mouth ulcers were never ending. I mean, a good day for me is 8 ulcers, a bad day was hundreds.
Most agree that there's nothing more important in life than good health, but it's often the first thing we take for granted. Imagine your body presenting painful, mysterious symptoms in multiple organs and going weeks, months, even years without an accurate diagnosis. For tens of thousands living with BEHCET'S disease, this is their reality.
It goes beyond chronic fatigue. It goes beyond not being able to function on some days.
You know, horrific headaches that would put me in bed for a whole day. You know, ones that I couldn't lift my head off the pillow for the whole day.
I would get mouth sores all the time. And then as I got older, I started to get pain in my bones. And then one day, I started throwing up everywhere.
BEHCET'S disease is a rare inflammatory disorder with a long list of various symptoms.
BEHCET'S disease causes inflammation in the blood vessels, and since blood vessels are everywhere in your body, you could have symptoms anywhere in your body. For instance, if the blood vessels in your mouth are inflamed, you would have mouth and throat ulcers. If the blood vessels in your skin are inflamed, you could have skin lesions. As far as your eyes, if the blood vessels in your eyes are inflamed, you would have vision problems. Even as far as your brain, if the blood vessels in your brain are inflamed, you could have brain impairment. So everybody can be different, have different symptoms, and they could be anywhere in the body.
These and other symptoms flare up for days, weeks, or even months at a time and can sometimes be brought on by stress or other trauma to the body. Because there can be different symptoms affecting different organs of the body simultaneously, BEHCET'S disease becomes extremely difficult to diagnose for doctors who are not familiar with this rare disorder. BEHCET'S is diagnosed clinically. There is no one specific test that confirms BEHCET'S disease, although there may be clues found in blood tests or skin pathology tests that may aid a doctor in making a diagnosis. Most often, a rheumatologist will make the determination. The main criteria used to do this are oral ulcers at least 3 times in 12 months and any 2 of the following: recurring genital ulcers, eye inflammation with or without loss of vision, characteristic skin lesions, a positive pathology test.
It was very hard watching her go through all this as a child. In my gut, I knew something was wrong.
He came in and he said, "Sandy, I think I've found what's wrong with you." He said, "It's a disease called BEHCET'S." And he goes, "I've never heard of it, but I want you to read this." And I took the information home. As soon as I got home, I read it, and it was me to a T. You know, I'm like, this is it. We found what is wrong with me.
It is such a relief to find out that she's been diagnosed with BEHCET'S. I know that might sound awful to some parents, but to have an answer to all her symptoms for all these years, and I think she felt crazy, and we probably felt crazier, thinking we weren't being good parents and didn't know what to do for her. So it was a relief.
Scientists theorize that some people with a certain genetic predisposition are more likely to develop BEHCET'S. But while BEHCET'S disease may be more common in people of Far East or Middle Eastern descent, there are thousands of cases of men, women, and children in the United States that do not have this origin, so genetics explains only part of the picture. Scientists also believe that the disease is triggered by viral, environmental, or bacterial elements. What are these elements? This question is at the heart of the BEHCET'S mystery.
BEHCET'S syndrome is still a mystery because we really don't know what causes the disease. And since we don't know why the disease happens, we don't have very well targeted treatments, which if we did have those, then we'd be able to probably stratify patients at the beginning and treat the ones that have bad prognosis more aggressively and treat the ones that have good prognosis maybe with lesser toxic medications.
There is no known cure for BEHCET'S, Patients must treat the symptoms and try to control the disease, often with intense medications. For some, the treatments are successful, and over time, the symptoms may become almost non-existent. But for others, the symptoms are uncontrollable, and their lives are dramatically impacted by Behcet's. With frequent hospital stays, infusions, and days of bedridden fatigue and fever, many struggle to just get through the day.
I have a lot of neuropathy. It makes doing almost everything more difficult. There are certain things I can't do, buttoning my collar button, for example. It makes everything harder and longer.
The pain is in every joint of my body. You can't explain it. It feels like you have the flu all the time. If you have a really bad case of the flu, is what it feels like.
Those who are fortunate enough to be diagnosed early have a better chance at managing their symptoms and living full lives. Olympic gold medalist Sanya Richards is one of them. After suffering with a sudden onset of excruciating oral and skin lesions and fatigue, Richards was quickly diagnosed with Behcet's in March of 2007. With her symptoms under control since January 2008, Richards became a standout in Beijing, taking home 2 track and field medals.
I actually think it might be good that I have Behcet's because I'm hoping that me having it will bring visibility to the disease and we'll get to a cure quicker. But naturally it's hard when you have something that's so rare and you don't know what can happen. I've been fortunate to only have 2 symptoms, but I know that it can get very severe and I can get more symptoms. So that is a bit of a fear, not knowing if it will get worse as I get older, or I feel great now, I don't know if I'll feel great in a year or not. But you know, I just believe that we're going to find a cure soon and I'll be healthy, and everyone else that suffers with it will be healthy as well.
Because Behcet's is rare and not well understood, more education is needed across the medical field, and research is critical to find better treatments and eventually a cure.
We need to fight for this disease because there is not a lot of research done out there. It's very minimal, and I feel like we have to make people aware. We have to make people in Washington, D.C. aware. I want to fight for every person that's going to be diagnosed with this disease down the road.
The American Behcet's Disease Association provides information and support to those who suffer with Behcet's, as well as their families and caregivers. The ABDA is also working hard to educate the medical community about this often misdiagnosed disease and is actively raising money to fund research and find a cure.
The main goals of the ABDA are to support those who have Behcet's disease, along with their family and their caregivers, through information and resources that might help them lead a better quality of life. Also, our mission is to educate the medical community. It's very important right now because doctors and healthcare professionals need to be able to see the signs and symptoms of Behcet's and diagnose it earlier. And thirdly, and very important, is we need to fund research and we need to find a cure. So following those steps, we hope to get to a cure to Behcet's disease.
With more research, there could one day be a cure for Behcet's. To meet this goal, the American Behcet's Disease Association needs your help.
Part of the problem is there isn't enough funding to do all the research that we need to do to identify all the patients early in disease course, so where we can make a big difference in their manifestations and improve their quality of life.
I'm 55 already. I don't know if there'll be a cure in my lifetime, but there's certainly research going on, I guess, at this point. The more awareness you have, the better off you are. I think the American Behcet's Disease Association is doing great work. I'm crossing my fingers for a cure. That'd be great. If not for me, for somebody else, it'd be fabulous.
Because Behcet's is so rare, nobody knows about it. And I want people out there from seeing this to understand that this disease is out there and that there's probably others out there that are misdiagnosed. So we need doctors out there. We are begging doctors to get an interest in our disease so that we can get this research done and find that cure.
For more information about Behcet's disease and to find out how you can help, visit BEHCET'S.com.